Greetings and welcome to Navigating Financial Issues Before, During, and After Transplant. At this time, all participants are in a listen-only mode. If you have not already done so, please close all of the programs on your computer. You may submit a question via the web at any time by using the Ask a Question feature on the left side of your screen. If anyone should require operator or technical assistance during the conference, please press *0 on your telephone keypad. It is now my pleasure to introduce your host, Jennifer Gillette. Thank you. You may begin.
Thank you, Roya. I'd like to welcome everyone to week 2 of our Caregiver webinar series. And again, I am Jennifer Gillette, Staff Social Worker at the National Bone Marrow Transplant Link. And we would like to thank you all for joining us this evening. Tonight's topic was designed to help you navigate financial issues before, during, and after transplant. I want to just give everyone a heads up before we start that first of all, this is going to be a great presentation with a lot of information to share, and I know that people will probably be interested in being able to see it again or to have the slides. And just so you know, this presentation will be on our website within about a week, and we also can give you copies of the slides. You can either contact us at the link or you can attach your information on our survey at the end of this presentation, and we will make sure you get those. Before we hear from our speaker this evening, we want to make sure you all know about the National Bone Marrow Transplant Link. We are celebrating 25 years this year of dedicated service to helping individuals and their families from diagnosis through survivorship. We work with hospitals, cancer centers, and other organizations to reinforce and complement medical care by providing resources, support, and education. We are here to help. And if you want, you're welcome to take a little note of that screen if you want to contact us. And again, we'll be happy to send you slides or any other resources. We'd also like to thank our sponsors for this evening who made this event possible. Be the Match, Leukemia and Lymphoma Society, Sanofi Genzyme Oncology, Insight Corporation, our dedicated board member, John Kosnin, and our esteemed link partners. On this slide, I'm just giving you a glimpse of some of the many resources we have available at the link, including our award-winning books and our DVD called The New Normal, which will guide patients and caregivers through all phases of the bone marrow stem cell transplant journey. I would also like to point out the Caregiver book, which is a favorite amongst hospitals, and we would be happy to have you reach out to us for that as well. In addition to these great books, we have several other ways we support people on a transplant journey. We have our chronic graft versus host disease telephone series and webinar. We have this caregiving series, which you are a part of. Our peer support mentor program for patients and caregivers. We have our second birthdays recognition program, and we provide other materials and resources and just someone at the end of the line to talk to if a patient needs support. The bottom line, we are here to help. Without further ado, I would like to introduce you to our speaker for this evening, Joanna Fozzie Morales, Esquire. She is a cancer rights attorney, author, speaker, and CEO of Triage Cancer, a national nonprofit organization connecting people to cancer survivorship, education, and resources. Joanna will speak to important topics such as picking the right health insurance, coverage, minimizing out-of-pocket costs, employment benefits such as job protection and paid leave, and solutions for unplanned expenses. Thank you, Joanna, for being with us this evening. We are truly honored to have you be a part of this webinar.
Thank you so much, Jennifer. So this evening, I am going to share a great deal of information on a variety of topics that can have an impact on finances. Now, the interesting thing about financial issues is that there has been increased focus on the cost of cancer care and how that is posing a financial burden on cancer patients and their families. And it's gotten so significant that there is a new term for it that is referred to as financial toxicity. But I would argue that even though we have a new term for it, it isn't a new problem. The cost of cancer care has always been significant, and there are a number of contributors to this concept of financial toxicity. And so I'm going to talk this evening about some of those factors, and primarily making sure that you have adequate health insurance coverage is one of the ways to minimize some of your out-of-pocket costs and expenses downstream, but also to understand how to use some of the consumer protections that are available to you, understanding how to manage some medical bills, but also to understand that there are employment changes that can obviously have an impact on our income, and to be able to understand how the law can provide some protections and resources if you're experiencing those employment changes. And then certainly other types of life changes can have an impact on finances, but tonight I'm really going to focus on the health insurance and employment aspects. Now, the interesting thing about talking about health insurance is that many people don't understand not only their own health insurance coverage, but really the healthcare system that we have in the United States. And I think that applies to physicians and nurses, as well as every single one of us who has a health insurance policy. And so if you feel like you don't understand your health insurance coverage, you are certainly not alone. And now it's not just my anecdotal opinion that says that, but also the research backs it up too. People who have health insurance coverage don't necessarily understand what they're paying for it or how to use it. And so I wanted to start with talking about our healthcare system for just a minute. In the United States, there's only 3 places we go to get our health insurance coverage. We're either getting it through an employer, we're getting it directly from an insurance company, or we're getting it through the government. And that could be things like Medicare, Medicaid, military or veterans health plans, and even state high-risk pools. I also wanted to talk about a few terms that not only am I going to use throughout the presentation, but they're the most important things that you need to know about your own health insurance coverage. And it applies regardless of what type of health insurance you might have. So in order to purchase health insurance coverage, we typically pay a monthly premium. So we pay each month just to have the insurance. Even if we never got medical care during the year, we'd still have to pay our monthly premium. But then there are costs that we pay when we actually get medical care and we use our health insurance coverage. And the first is our annual deductible. It's a fixed dollar amount that we pay one time each year before our health insurance coverage even kicks in. So you could have a $500 deductible, or you could have a $5,000 deductible, depending on the type of coverage that you have. And then there's something called a co-payment. And this is also a fixed dollar amount that you pay when you get certain types of care. So maybe you have a $20 co-payment to visit the doctor's office, or you have a $40 co-payment to see a specialist, or you might have a $250 co-payment to visit the emergency room. And that's different than coinsurance or cost share, and those are terms that are used the same way. So coinsurance and cost share is the difference between what you pay for your medical expenses and what your insurance company pays for your medical expenses. So you are literally sharing the cost of your medical expenses. And so if you have an 80-20 plan, your insurance company is going to cover 80%, and you're going to be responsible for the 20% after you've paid your deductible. Now, Medicare would be a good example of an 80-20 plan. And then there's something called an out-of-pocket maximum. And this is probably the most important thing that everybody should know about their health insurance coverage. Because your out-of-pocket maximum is a fixed dollar amount that when you reach that dollar amount in your out-of-pocket spending on your medical expenses, then your insurance will kick in at 100% and you don't have to pay anything else out of pocket for the rest of the year. So you might have, let's say, a $2,000 out-of-pocket maximum. The way you reach that out-of-pocket maximum is kind of a math problem. So You can use your deductible to meet that, plus any co-payments that you make, plus any co-insurance amounts that you make. And then once your out-of-pocket spending reaches $2,000 for the year, then your insurance is going to pick up all the rest of the expenses for the rest of the year. So to give you an example of how this actually works, David has been in the hospital for a week, and he walks out of the hospital with a $102,000 hospital bill. But his health insurance plan has a $2,000 deductible, it's an 80-20 plan, and he has a $4,000 out-of-pocket maximum. So how much of that $102,000 hospital bill does he have to pay? So first he's going to pay his $2,000 deductible, which means there's $100,000 left of that bill. But he has an 80-20 plan, so the insurance company is going to pay 80%, and that still leaves him with 20% or $20,000 left that he has to pay. So of that $20,000 that is left, he only has to pay another $2,000, and then he'll have hit his $4,000 out-of-pocket maximum. So I'm certainly not suggesting that $4,000 isn't a lot of money, but it's definitely better than the $102,000 hospital bill he started with, or even the $20,000 co-insurance amount that he was responsible for paying. So understanding what your out-of-pocket maximum is so important for your own plan, and it's also something that you can look at when you're picking plans, and I'll come back to that in just a minute. Now, prior to January 1st of 2014, Medicaid was one of the 2 federal health insurance programs that were available to any individual who had a low income level and a low asset level and met some other category of eligibility. And so there were these different doors into the Medicaid program. And most of the time, someone with a cancer diagnosis was accessing the door on the left, the Aged, Blind, and Disabled program. And they were accessing that program by showing that they had a disability under Social Security's standard of disability, which is a very high standard to meet. So that was a barrier to accessing Medicaid, but also the asset requirement. So even where individuals with a cancer diagnosis were not having any income coming in because they've stopped working, they may have had a 401k plan or some savings that was kicking them out of eligibility. And then the Affordable Care Act came along and expanded access to the Medicaid program and eliminated that asset requirement. So the new door into the Medicaid program is for any adult with a household income under 138% of the federal poverty level. So for an individual, this year, that would be anyone who makes under $16,642. They are not going to look at your assets. It's only based on income. But the thing about the Medicaid expansion under the ACA was that the ACA said it would be mandatory for every state to expand their program. And then the Supreme Court got their hands on the Affordable Care Act, and they made it voluntary for states to participate. And so this is what it looks like today. The states on the left have expanded access to their Medicaid programs, and the states on the right, 19 states, have chosen not to. And those 19 states represent about 5 million people who would have gotten access to coverage but haven't because their states have chosen not to expand. Now, the ACA also created a second way to access health insurance coverage, and that was in the creation of state health insurance marketplaces. And these marketplaces were originally called exchanges in the law, but no one understood what an exchange was. They decided to call them marketplaces, and frankly, no one knows what a marketplace is either. So it's caused a lot of confusion because there's a lot of terms being used to describe the same thing. And then some states run their own marketplaces. Like California, for example, their marketplace is called Covered California. So the best way to describe these marketplaces is like an insurance shopping mall. It's one place where you can go to find all of your private health insurance options for an individual health insurance plan or a plan for your family. And there are some benefits to actually purchasing plans through the marketplaces. And one of the benefits is that there is a cap on the out-of-pocket maximums that plans can impose in the marketplace. So theoretically, you're not supposed to be able to find a plan in any of the state marketplaces that has an out-of-pocket maximum more than $7,150 for an individual plan. Now, again, that's a lot of money, but it is often much lower than what we see in many employer plans. So we've seen employer plans with out-of-pocket maximums of $15,000 or even $20,000. So this is something that could be a benefit to you. And then you might also qualify for financial assistance to access the plans in the marketplace. And there's two types of financial assistance. There are premium tax credits, which lower what you pay for the monthly premium. And then there's cost-sharing subsidies, which lower what you pay for your co-payments, your deductibles, and your co-insurance amounts. Also, all the plans in the marketplace are standardized, so you can actually compare apples to apples and oranges to oranges. And I often say that we spend more time kind of doing cost comparisons and research on new phones or new cars or even new fridges than we do in spending time kind of sorting through our health insurance options. And part of the reason has been that it's very complicated to do that, and the ACA gave us some tools to make it easier. So the plans that are sold in the marketplace are standardized by their cost share. And the lowest level of coverage is a bronze level plan, which has a 60-40 cost share. Silver is 70-30, gold is 80-20, and a platinum level plan is a 90-10 cost share. There is a fifth level of plan called catastrophic coverage, but it is very minimal coverage, and it's only available to young adults under the age of 30 or for someone who qualifies for a financial hardship exception. Now, if you're visual, this is what it looks like if you are in a state that has expanded access to the Medicaid program. If you have a household income up to 138% of the federal poverty level, you have access to Medicaid. If you are between 138 and 250% of the federal poverty level, you have access both to the premium tax credits and the cost-sharing subsidies. And then if you're between 250 and 400% of the federal poverty level, you have access just to the premium tax credits. Now, if your income is over 400%, you can still buy a plan in the marketplace, you just don't qualify for financial assistance. So that means basically that if you have a family of four making under $97,000 a year, which is frankly the majority of our country, then you can get access to some type of financial assistance to purchase plans through the marketplace. Now, one of the most effective ways to avoid higher medical bills is making sure that you have adequate coverage. And again, that used to be a lot harder, but now you can actually make some comparisons in the plans that are available to you. And one of the ways to do that is by looking to see what's available in your state marketplace. And so this is healthcare.gov's homepage, but if you go directly to the link healthcare.gov/C-plans, it will take you directly to the page where you only need to enter in your age, your zip code, your income, and the number of people in your household, and it will show you all the plans that are available to you based on where you live, as well as the amount of financial assistance you would qualify for. So it's a very useful tool to be able to see what's available. Now, this exercise in comparing plans that I'm going to show you can actually be used when you are comparing two different types of marketplace plans. It can work when you're comparing two different plans that your employer offers you, or even more choices. It also works if you want to compare what your employer is offering you against what's available to you in the marketplace. And it also works if you have two Medicare plan options that you want to compare. So what you can do when you are looking in the marketplace is actually sort all the plans that are being shown to you. And you can sort by the level of plan, so is it a bronze or a silver or gold or even a platinum. You can sort by the total yearly costs. You can sort by premium amounts. You can sort by deductible amounts. And it also lets you sort by insurance company. So you can say, I only want to see plans that are being sold by this insurance company. So it gives us some of those tools that are available to us in other aspects of shopping online. Now, just as an example, I have found 3 different plan options for someone who lives in Kansas. And I have picked the cheapest bronze level plan. I've picked a silver plan in the middle and the most expensive platinum level plan. And you can see that the premium for the bronze level plan is $173 a month, but it has a $6,000 deductible and a $6,000 out-of-pocket maximum, which is pretty high. But for another $100 a month in monthly premiums, the silver level plan has a $2,500 deductible and a $5,200 out-of-pocket maximum. So that out-of-pocket max is still a little bit high. And then if you look at the platinum level plan, for another $120 a month, you could get a plan that has a $0 deductible and an $1,150 out-of-pocket maximum. So when you're making choices between the plans that are available to you, just by looking at this information, can you tell how much it's actually going to cost you by the end of the year to have that plan, assuming that you are going to hit your out-of-pocket maximum? And when we're talking about cancer care, almost everyone is going to hit their out-of-pocket maximum during the year. So the way that you can compare the plans is by doing the math. And the way that you do the math is you take the monthly premium and you multiply it by 12, because that's how much it would cost you to have the plan for the full year. And then you add that amount to the out-of-pocket maximum, because that's the most that you're going to pay out of pocket during the year for your medical expenses. So then by the end of the year, if you look at these 3 plan options, even though that monthly premium for the platinum level plan is very high and we get a little bit of sticker shock, it actually saves you, $2,000 to $2,500 a year. So $2,000 to $2,500 a year would be saved by going with that platinum level plan, because it has that lower out-of-pocket maximum, even though it has a higher premium. Now, every single group of plans that you compare is going to come out differently. I do this all over the country in all different contexts, and every plan I choose ends up coming out differently. So sometimes bronze is cheaper, sometimes silver is cheaper. So whatever plans you're looking at, you can do this exercise to see what it's actually going to cost you by the end of the year. And now with open enrollment, you can actually make choices. So generally with employer plans, you can change your choices every year, and you're allowed to change your marketplace plans every year. And if you have Medicare, you can change your Medicare plans every year. And so it's important to actually do that. Now, it's not just cost that's a factor when looking at coverage. You also need to make sure that you're looking at whether or not your providers are actually covered by whichever plans you've chosen. Because what's the point in actually having coverage if it doesn't cover your providers? And the same thing with your prescription drugs. You need to make sure they're covered by whichever plans you're looking at. And the marketplace actually gives us a tool to do that now. So once you've clicked on a plan, that box on the right-hand side allows you to actually enter in the doctors and the facilities and the drugs that you take, and it will sort the plans by whether or not they include the coverage for those things. So it's a very useful tool. Now that's the way to sort of avoid some medical bills that have higher out-of-pocket costs ahead of time. But you can also shop around. And we are not used to this idea that we could actually shop around for our healthcare coverage, and that's a big generalization because sometimes you're seeing a specialist where there aren't a lot of other options to do that. But you can ask questions like, how much is my treatment actually going to cost? And is there a way to lower any of those costs throughout my care? Does the hospital that I'm getting treatment at actually have an ability to pay program, or other types of discounts or financial assistance programs? You have to kind of proactively ask sometimes about some of these options in order to get that type of information. Now, one place where we see some challenges around insurance coverage is when someone wants to participate in a clinical trial. And there's a lot of confusion about participating in clinical trials. And so I wanted to share this resource with you. Genentech and the American Cancer Society created a series of videos that deal with some of the questions people have about clinical trials. And one of those videos includes information about insurance coverage for clinical trials. The Affordable Care Act requires insurance companies to cover the routine costs for participating in a clinical trial, and that applies to private insurance plans. And routine costs are all the things that would have been covered in standard of care. So the blood work and the lab tests and the imaging scans and the doctor's appointments, all of those things are considered routine, and generally it's everything except the actual drug or procedure being tested in the clinical trial, and that's usually paid for by the trial. So the idea was to try to remove some of the financial barriers to people participating in clinical trials, because we don't get scientific advancements if people actually aren't participating in clinical trials. Now, the ACA is a federal law. Many states also had state laws to address insurance coverage for clinical trials, so some state laws might actually be better. And on our website at triagecancer.org, we have a chart of state laws that can tell you more information about your state specifically. Now, when we're talking about someone who has Medicaid coverage, it is state by state. So the federal government doesn't require states to cover in clinical trials, but they might, and that's going to be specific to your state, and so you can look at your state Medicaid plan for more information. But if you have Medicare, Medicare also covers the routine costs of participating in clinical trials. And if you have either TRICARE or a Veterans Affairs plan, they also have specific rules about participating in clinical trials and how they cover that participation. And I've included links for that information. If an insurance company does deny coverage, either for a clinical trial or for another reason, you do have the ability to appeal that decision. This is definitely an example of when you don't want to take no for an answer if your healthcare team has made a recommendation on getting a particular treatment or procedure, or even accessing a prescription drug. And so you can appeal that decision internally with the insurance company, but the ACA also made it a federal requirement that every state also provide an external appeals process where you can go outside the insurance company to get your coverage covered by the insurance company if it's medically necessary. And now this sounds like a kind of painful process and a lot of work, but it can actually be really worth it because across the country over the last couple of years, 40 to 60% of appeals have actually been won. And so just taking that extra step to appeal the insurance company's decision is going to get you much more closer to getting your care covered. And when you get medical bills, you can actually negotiate. So if you are proactively trying to address medical bills that you've received, you can talk to your healthcare providers and explain your financial situation and either offer to come up with a payment plan. Sometimes healthcare professionals will write off a portion of your bill. Some will even accept a lump sum payment. So for example, if you owe $2,000 and you only have $1,000 to be able to pay it, you could say, instead of going on a payment plan, I can pay you the $1,000 right now if you'll write off the rest of the bill. And this is pretty common practice. So it sounds unusual, but healthcare professionals are typically pretty comfortable in talking about this. And this process doesn't just work with healthcare providers, it also works with your other creditors. So it's worth asking, because if you don't ask, you definitely won't be able to get access to help. Now, as you are compiling your expenses and your medical bills, it's important to keep track of all of those expenses. And it doesn't just mean the bills that you have that you've paid providers, but it can also be things like your travel expenses to treatment. So I live in Los Angeles, and parking at the hospital is expensive, and that adds up pretty quickly. And those expenses could be tax deductible. And so we have a blog on our website that talks about medical and dental deductions on your taxes and how to actually go about doing that. And so that might be a resource for you as well. Now, when you're looking at your financial picture, it is important that you start by taking stock of your finances. And on our website, we have a spreadsheet that you can customize for yourself to be able to keep track of all of your assets and all of your expenses and liabilities. And sometimes it's painful for us to kind of look at this picture of our finances, but it's very important to be able to manage your finances moving forward and to find ways to address how to get help with financial assistance and also lower some expenses that you might be able to. So this resource is available for you. And once you've kind of looked at your assets and your liabilities, where you are right now, then you need to think about moving forward and creating a realistic budget about where your income and expenses actually are. And we tend not to want to do this either because then we have to admit things like what we pay to have our hair cut or our nails done or our lawn mowed or whatever other expenses you might have that you don't pay attention to on a daily basis, but they are expenses and they are tapping your income. And so looking at your budget and creating a realistic budget for you moving forward is a good next step. And you can create it on your own. There's lots of free templates that are available online, or you could use a more technical solution like QuickBooks or some other type of software. So once you've created a budget, if you feel like you have questions about how to do that or need help managing your finances or even dealing with creditors, you can talk to a consumer credit counseling agency. And it's important that if you do this, that you actually go to one that's accredited. This is an opportunity for a lot of scams that we see. So the National Foundation for Credit Counseling has a list of the local accredited consumer credit counseling agencies. You can also talk with a financial planner locally, and you can go to the Financial Planning Association for referrals. But you might see things on TV or you might get an ad in the mail that says you can renegotiate all of your debt. And that could be a good option for you, but it's important to know that some of those debt solutions could lower your credit score. And that might be less important to you than working out your payments, but it's important to know that that might be the case. So transitioning into employment, there's actually a lot of places where people can go to find information about their employment rights. And there are federal fair employment laws that protect people with cancer in the workplace, such as the Americans with Disabilities Act or ADA, and there are also state fair employment laws that do similar things. But sometimes the state laws are actually more protective. So it's important to look both at what's available to you at the federal level and also what's available to you at the state level. And then there's laws that we refer to as leave laws, where you are able to take time off work and have access to some job protections and even health insurance protections. And again, those are laws like the Family and Medical Leave Act, which are available at the federal level, and then there's also state laws. And some of us actually work under an employment contract, and like a union contract. And those contracts can actually give us more information about what's available to us in terms of benefits. And sometimes you're gaining some benefits and protections, and sometimes you're waiving them. So you want to be looking at those employment contracts for more information. And then we forget that the law just provides the bare minimum of what employers have to do. There are so many employers that go above and beyond and provide more benefits and protections than they're required to under the law. So in most cities and states, getting access to even just an hour of sick leave isn't a legal requirement. That's something that the employer is offering to their employees. And so looking at your employer's policies specifically is going to give you a great deal of information about what's available to you, whether you need to take time off for yourself or if you're taking time off as a caregiver. All of that information is going to be contained in some version of an employee manual or handbook or some type of policies and procedures document. Now, the Americans with Disabilities Act, or the ADA, is one of the most important legal tools available to individuals with cancer to help them work through treatment or return to work. And it's interesting because many people who are diagnosed with cancer don't consider themselves as having a disability and therefore wouldn't think that they'd be protected under the ADA. But this is one of those situations where it's so important to understand how these protections apply to you. Otherwise, you may end up missing out on certain benefits. The ADA is a federal law that prohibits discrimination against people with disabilities in several different contexts, and most people are familiar with requirements like having accessible parking. But Title I of the ADA provides protections in the workplace for people with disabilities. But not everyone is going to be eligible for protection under the ADA. So first you have to work for a private employer with 15 or more employees or work for a state or local government. And if you're a federal employee, you're actually going to be covered under the Rehab Act of 1973, which is very similar to the ADA's employment protections. The second requirement is that you actually have to be a qualified individual. And legally, that means you're able to perform the essential functions of the job with or without a reasonable accommodation. So practically, what that means is you're actually qualified for the job that you have or that you're applying for, and that you can perform the essential job functions. But you can get help to do that through an accommodation, and we'll come back to accommodations in just a minute. And the last requirement is that you actually have a disability under the ADA's definition of disability. Now, that does include someone with a cancer diagnosis. And so I'm not going to go into great detail about why that is, but someone with a cancer diagnosis can be qualified as having a disability under the ADA's definition. Now, the ADA applies to all phases of the employment process, which means that it doesn't just provide protections when you're an employee, it also provides protections when you're a job applicant. So before you even get the job, you're entitled to protection under the ADA. So if you've figured out that you qualify under the ADA for protection, what does that actually get you? It provides protection against discrimination, and that actually also includes caregivers. So caregivers who are being treated differently at work because of their caregiving status are protected against discrimination under the ADA. It also gives you access to reasonable accommodations. Now, reasonable accommodations are any change in the work environment or in workplace policies that enable someone with a disability to enjoy equal employment opportunities. Practically speaking, that means that a reasonable accommodation could be anything that is going to help someone either continue working or returning to work. Now, while reasonable accommodations are available to anyone who has been diagnosed with cancer and qualifies under the ADA or has a history of a cancer diagnosis, it doesn't apply to caregivers. So while there are lots of practical examples where accommodations could be useful to caregivers, it isn't required that employers provide accommodations to caregivers under the ADA. And if you want more information about accommodations, we have a quick guide that explains accommodations in detail and gives examples of types of accommodations that could be useful for someone who is going through cancer treatment. Now, I mentioned that there are also state laws that are similar to the ADA, but that some state laws are more protective. And one of the ways that state laws are more protective is that they actually cover smaller employers, because the ADA only covers employers, private employers with 15 or more employees. So this chart actually shows the number of employees each state law requires for an employer to be covered under the state fair employment law. So for example, if you live in Illinois, your employer only needs one employee to be protected under the state fair employment law. If your state isn't on this chart, the state law is actually the same as the ADA and covers employers with 15 or more employees. Now, the Family and Medical Leave Act, or the FMLA, is a law that people are more familiar with. It provides protections for people who need to take time off work either for their own serious medical condition or to care for a spouse, a parent, or a child with a serious medical condition. But you also have to work for an employer that has 50 or more employees or work for a state or local or federal government to be protected under the FMLA. You also have to have worked long enough to be protected under the FMLA. So you have to have worked for the employer for at least 12 months and worked 1,250 hours in the last 12 months you worked for the employer. But the 12-month requirement doesn't actually have to be consecutive. So there are lots of industries where people come and go from employers. And if you worked for an employer for 7 months and then you leave for 3 years and you come back and work for an employer for another 5 months, after working for that 5-month period, you'd then be eligible for FMLA leave as long as you've worked 1,250 hours. So what does the FMLA do for you? It gives you up to 12 weeks of leave per year. But it is unpaid leave, which can be incredibly challenging because most people can't take 12 weeks off work completely unpaid. But you can substitute the unpaid leave with any paid leave that you've accrued. So if you have sick days or vacation days or even a short-term disability policy, you could get paid by that leave, while the FMLA provides job protection, and it also protects your health insurance coverage if you get health insurance coverage through your employer. So if your employer normally pays 100% of your health insurance premium and you pay 0, that has to continue for the period of time that you're on FMLA leave. The FMLA can also work with the ADA in that if you've used up all 12 weeks of leave under the FMLA and you're not able to come back to work, you could potentially ask for additional time off from work as a reasonable accommodation under the ADA. But all of the cases have suggested that additional period of time has to be for a specific period of time. You can't just say, I don't know when I'm coming back to work. But if you can say, my doctor has said that I'd be released to come back to work in 3 more weeks, that additional 3 weeks could be a reasonable accommodation under the ADA. Now, while the FMLA is federal law, there are many states that have all types of leave laws, and I've included some examples of those different types of state laws that could be helpful to people who need to take time off, either for themselves or as a caregiver. And I've included a link to our chart of state laws for more details on these options. Now, because taking time off from work can be expensive, if you don't have any income coming in, disability insurance is a way to replace your wages if you are taking time off for yourself. And there is a lot of different types of disability insurance. So there's private disability options that you buy either directly from an insurance company or you get it as part of an employee benefits package through your employer. And it might be that your employer pays 100% of the premium or you pay the premium. And many people tell me, oh, I don't have disability through my employer, and then they go back and they look at their employee manual and it turns out that they do, but because they don't pay for it, they'd forgotten all about it. And so it's a good thing to look to see if this is an option for you. There are also 5 states and Puerto Rico that offer state disability insurance, where you pay into the system and then can access short-term disability benefits. And then there are also 2 federal long-term disability programs that are run through the Social Security Administration called Social Security Disability Insurance, or SSDI, and Supplemental Security Income, or SSI. And these are programs where we have a lot of information about the details of how to apply for these programs, as well as appeal any denials if you are denied. So there are more resources on this topic. But I did want to share one thing that we are seeing happening that has a huge financial impact for anyone who qualifies for SSDI. If you have a private long-term disability plan, like through your employer, and you apply as soon as you take time off work, and then maybe 5 or 6 months in, that company sends you a letter and says, we would like you to apply for SSDI. They are allowed to do that. So when you apply for SSDI and you finally get approved, they might pay you retroactive benefits. So when your first check comes, your check is actually a lot bigger than you would normally get each month. and you get excited because you feel like you can finally pay some of your bills, and you spend that money. And then a few weeks later, you get a letter from that long-term disability company, and that company says, can you please pay us back those retroactive benefits? You owe those to us. They can also do that because now effectively you've been paid twice for the same period of time you've been off work. But what happens is that if you don't have the money to pay them back and you've spent it, they can place a lien on your benefits. And that is a huge financial burden for people. And so we want to make people aware of this challenge before they get their retro check and spend it, because it's going to have to be paid back to the long-term disability company. So as I mentioned, there are a lot of other resources on the topic of disability insurance that I've included links to here for you. For caregivers who are taking time off under the FMLA or even a state leave program, there might not be any income coming in. And so some states have created state-paid leave programs for caregivers that replace some of the wages that are lost when a caregiver needs to take time off work. And the newest state that actually passed this law is actually Washington just a few weeks ago. And if you want more information about these paid leave programs, you can find that on our state chart. But there is also the in-home support services program. And this program is called slightly different things in every single state, but they are all run through the state Medicaid program. So you can start there to find out if you have access to this program. And what this program does is it actually pays you as a caregiver for your family member who qualifies for the state Medicaid program. So it can be a good way to replace some of those wages. Now, the rest of the slides in this section around finances are just some tips and ideas for where to access maybe some hidden money that you have access to. So for example, oftentimes we have mortgages or loans or credit cards that have a clause in them where if you have a disability and you are not working, they will suspend your payments, so you don't have to make your monthly payments. But you have to proactively go and check your policies to see if this is something that's available to you. Now, on cancerfinances.org, this is a website that is entirely focused on topics related to finances. There is a module up on health insurance, there is one up on disability insurance, and there is also one that just has financial assistance resources all across the country. And so there are resources on topics like treatment assistance. So if you need help paying for treatment, there are resources there, and I've included just a couple. There are also resources related to transportation and lodging if you have to travel to get to treatment. And then there are resources that have to do with sort of daily living expenses, and even if you are in school or need to deal with student loan payments, there are resources there as well. So I've included these just as a reminder of what's there, with a lot of additional resources for you. Now, the last thing that I wanted to mention is that we do also have a great deal of education and other information on all the things that I've talked about today on Triage Cancer's website. So we have webinars on many topics related to what I've talked about today, as well as many others, and you can watch the webinars live or see past recordings. We also host in-person conferences around the country on many of these topics, and we have educational materials that we refer to as quick guides, as well as our chart of state laws and state-specific resources on many of the topics that I talked about today. So our goal with today was to provide you with an overview of some of these topics so that you know what is available to you and how to take next steps to access that information. So at this point, I'm going to turn it back over to Jennifer.
Thank you so much. Joanna, you are such a resource, and again, we are so honored to have you be with us tonight. We did receive a few questions, And some of them we're probably going to have to get to individually, and we promise we will get back. But we're going to ask one of these. When a person receives long-term disability, is it a tax-free benefit? Since it doesn't show on a tax return, must it be reported income when looking for marketplace plans or Medicaid coverage?
That's actually a great question. And so unfortunately, my answer is it depends. And it depends on the type of long-term disability benefits you're referring to and how you got access to them and the structure of that program. So sometimes it depends on whether or not the employer pays for the premiums or if you paid for the premiums. And then it's also different under SSDI or SSI. So generally speaking, SSDI is taxable, SSI is not, but if you, I can certainly share more information offline with you about that in particular.
Great, and we are happy to share that. Well, here's another one, too, we probably have time for. I am on SSDI, Medicare, and a supplement. Can I apply to Medicaid to cover my Medicare premium?
If you are on both SSDI and Medicare, you could potentially access Medicaid to offset medical expenses that Medicare doesn't cover, but Medicaid is going to depend on your income level. So if you have SSDI and Medicare, your SSDI payment might be high enough to kick you out of income eligibility for Medicaid. But again, that's going to depend on your specific income level. And you can certainly ask the Social Security Administration, or you could call 800 Medicare to find out if you would qualify for the Medicaid program and then actually to apply for it.
Great, thank you, Joanna. And actually, I think this will probably be our last one. Are you aware of an insurance company that has a reputation for being able to cross state lines?
That's an interesting question. So it is very difficult to recommend one insurance company because every plan sold by an insurance company can be so different, and it can be so different in different states. The challenge with buying a health insurance plan across state lines is that many states have provided consumer protections, even things like requiring an insurance company to cover a mammogram. That could be what we refer to as a state mandate. If you, for example, live in California and you are going to go buy your insurance plan from Nevada, if Nevada doesn't have those protections, the insurance company doesn't have to offer you the protections. So being able to access plans across state lines sounds like one of those things that would be fantastic because it would create more choice. But the downside is that you lose access to all the consumer protections that are offered in certain states. And there is, generally speaking, the concern that if that is possible, then insurance companies are only going to sell plans in states that don't have any protections for consumers. Now, that's a dramatic end result, and it may not happen, but those are the two sides of that issue.
Great. You know, Joanna, that's all we have time for this evening. Again, we will try to get back to everyone with their questions, but again, we just thank you. You have taken such a complicated subject and made it so personable and easy to understand for people. So I thank you so much for being with us this evening. And we'd also like to invite those listening to take our quick survey at the end of this webinar. This will enable us to help future caregivers and survivors. Thank you so much for attending this evening, and we hope you have a wonderful night.
Thank you. This does conclude our teleconference for this evening. You may now disconnect your lines at this time. Thank you for participation and have a wonderful night.